University of North Carolina, Chapel Hill. I read bits and pieces of it the other day, but let me read it again to you because it's pretty darn important. And look, it might not be important to you, but you might know somebody that has diabetes in their family. You might know somebody that's pretty overweight, and when you're overweight and obese, you're sort of predisposed to diabetes and metabolic syndrome, especially if you got all of that belly fat and your lipids are high and your waist size is a little too big. You might want to say something. Hey, you should be supplementing with magnesium. And get this, 68%, almost 70% of Americans do not consume the recommended daily allowance of magnesium. 20% of Americans don't even consume 50% of the RDA. It's a very, very deficient mineral, and it's responsible for normal function of the nervous system, the cardiovascular system, your heart and brain. And here's the most important thing about magnesium: 325 magnesium-dependent enzymes in your system, including the enzymes that run the mitochondria, the energy factory in your body. And you can look, it's easy to find magnesium. It's in pumpkin, it's in almonds and Brazil nuts and sesame seeds and peanuts and walnuts. It's easy enough to find. You just got to make sure you're getting it into your body. Here's what it says in this article from University of North Carolina. It says getting enough magnesium in your diet could help prevent diabetes. It continues, people who consume the most magnesium in foods and supplements are 50% less likely to develop diabetes as people who took the least magnesium. It says the results may explain in part why consuming whole grains, which are high in magnesium, is also associated with lower diabetes risk. It says magnesium could influence diabetes risk because the mineral is needed for the proper functioning of enzymes, of course, that help the body process glucose. I'll read that again. Magnesium is important as a cofactor for the enzymes that help the body process blood sugar called glucose. They did a study, 5,000 people, men and women age 18 to 30, young crowd. People with the highest magnesium intake, which averaged about 400 milligrams a day, were 47% less likely to develop diabetes than people with the lowest intake. And this is what they concluded: as magnesium intake goes up, levels of several markers of inflammation go down. Not only does magnesium help control the blood sugar and insulin levels, but it controls and helps modulate the levels of inflammation. That's really, really important. And so what the conclusion is that higher levels of blood magnesium are linked to a lower degree of insulin resistance, of inflammation, of abnormal sugar metabolism, and increasing, as they write here, magnesium intake may be important for improving insulin sensitivity, reducing systemic inflammation, and decreasing diabetes risk. There you go. Because we never have enough time to go into any of these things in detail. But if we were going to spend a minute or two at looking at the consequences of magnesium deficiency, and we were to put together a list like I would in a classroom, what do you look for in your patients, would be the classroom conversation, that might indicate to you as the practitioner that they might be deficient in magnesium? So again, think of yourself when it comes to this list of symptoms. Number one, chronic fatigue, weakness, and exhaustion, without a doubt. Number two, excessive noise and pain sensitivity. You're just sensitive to everything. High blood pressure. Of course, when magnesium is not there to relax your blood vessels, they constrict. Your blood pressure goes up. Headaches, irritability, nervousness and anxiety, depression, apathy, muscular tics and spasms and cramps, difficulty with memory and concentration, chronic constipation, confusion, disorientation, poor appetite. Do you have any of those symptoms? Well, you want to think about that.